Whenever anyone comes into our office, they want to know two things. Why is my hair thinning, and what can I do to turn that process around? Surgery is sometimes an option, and I'll get into that in a different video, but a lot of people aren't interested in surgery, and they want to know the various non-surgical remedies that can help reverse the process of hair loss. And so the way that I like to present it to patients so they can really understand all the different influences that are potentially leading to their hair loss is with this chart, this visual. On the left-hand side, you can see the different types of influences. There's a hormonal influence. Potentially there's a nutritional influence. There can be an inflammatory influence. There can be an influence on the cell cycle of hair. There can be a structural component that's of the hair that's causing it to seem thinner. And there can be a microbial influence. That's not something that's really well elucidated at this point, but it is something that we're looking into as a field. And of course there's genetic influence, and there's nothing we can do about that, but that is oftentimes the primary influence on men and women undergoing hair thinning. If you look at this chart, there's different columns as well, and as you go to the right, that's the way that I sort of present the strongest, potentially most effective therapy. So when you go from level 1 to level 4, that approach is a little bit more aggressive and potentially a little more effective. So let's take a look at the chart. Okay, the first influence, hormonal influence. Well, there's one of the most benign approaches is there's a lot of medicated shampoos. Oftentimes, even over the counter, you can look at the active ingredient in different shampoos and you see 1% ketoconazole. Ketoconazole is an antifungal, but it also has an anti-androgen effect. Androgens that's the type of hormone that can cause our hair to thin out. So sometimes medicated shampoos, even caffeine, can have that effect. Saw palmetto, things like that, which is a homeopathic DHT blockers. Those can be found in shampoos. Moving to the next level, certainly there are topical sprays that have a drug called finasteride. Finasteride is also known as propecia. What that can do is it can decrease the amount of DHT by blocking the conversion of testosterone to DHT, or dihydrotestosterone. The advantage of topical blends versus the oral form of propecia or finasteride is you don't have the systemic absorption that you would have to the same degree as with a pill. So the disadvantage of topicals is they can take a little bit longer than a pill form can. The advantage is you don't have the systemic absorption that you have with a pill, and therefore you don't have the risk of sexual side effects that you'd have with the pill form. A stronger version, or a stronger medication, is topical dutasteride, which more effectively lowers DHT levels. It's a little more general. It attacks both parts of the 5-alpha reductase enzyme, but it is more effective than finasteride, and it also has a longer half-life. In this same category, I put the finasteride pill. I would say they're about equally effective, but again, with the topical dutasteride, there's not the same degree of systemic absorption that you'd have with the pill. Now, I'd say the strongest and potentially the most effective is injections of dutasteride. Spain has really been leading the charge, physicians in Spain, on this front. They do quite a bit of dutasteride mesotherapy and have provided evidence to show that that can really help strengthen hair in terms of caliber, in terms of hair numbers, and this is something that I'll get into more detail in a different video. The next category, nutritional, well, biotin. You can get that at any pharmacy. It's over the counter. That's a B vitamin that helps increase the rate of hair growth. Hair is a tapered structure. It's thinner at the tip than at the base, so as it comes in, it can become a little bit thicker and fuller. Inflammation, again, medicated shampoos. Ketoconazole also has a mild anti-inflammatory effect. That might be one of the mechanisms for its helping with combating hair loss. PRP, platelet-rich plasma, that has a long-term anti-inflammatory effect. It's really popular in orthopedics for that reason. When people have inflamed joints, it's something that they have as a treatment. Well, with hair, inflammation can also be something that's causing your hair to thin out. So PRP series is something that can help have a long-term anti-inflammatory effect. And I'll get into more detail again in a separate video. Apoptosis, which is cell death, that's something that can cause hair to thin out and shorten the hair cycle. Well, minoxidil or Rogaine is something that can help prolong the anagen phase or the growth phase of hair. That's very simple, very benign. It's level 1 in my opinion. Oral minoxidil is another approach, when you're absorbing it systemically, it can also make you dizzy, lightheaded, so I don't think it's quite as benign as minoxidil. I think from a purely cell cycle or cell death perspective, PRP is more effective in holding back the process of cell death, but PRP combined with dutasteride injections is probably the most effective way to combat that influence. Structurally, again, biotin is something that can be helpful. Volumizing shampoos can also help with your hair structure. If you look at one of your hair follicles under an electron microscope, it kind of looks like a reptile in a sense, like the scales of a reptile. Those are the cuticles of hair. So with volumizing shampoos, those can actually sort of open up your cuticles and give your hair more volume. It doesn't do anything really biologically, but aesthetically, cosmetically, it can have a nice effect in terms of increasing just the look of your hair. Bacterial, well, the scalp microbiome is not really well understood. But if you think about the gut microbiome, years ago, nobody talked about it. Nowadays, it's pretty well known that the specific gut microbiome in different patients can have a tremendous impact on their overall health. Well, we're learning more and more about how there can be good and bad bacteria of the scalp that can have a positive or negative effect on hair. Different medicated shampoos can help influence that microbiome. For years, ketoconazole, the antifungal, is something that it helped address a certain type of fungus called Malassezia fervor, and in doing so, it calmed the scalp and helped hair regrow when people had a condition called seborrheic dermatitis. That's just one of the many types of organisms that we're finding on the scalp and that can have a positive or negative influence on the scalp. PRP, one of the other benefits is people believe that it may have the effect of improving the scalp microbiome. That's just something that we're starting to explore as a field. Genetics, well, if you look at the last influence, there's really nothing that can be done about that from a non-surgical standpoint. We're destined to have the genetics that we have. However, oftentimes when people have hair thinning here, but a really healthy donor area, surgery can have a tremendous effect on stopping hair loss, giving patients a healthy framing of their face, and increasing overall scalp coverage. I'll get into much more detail in different videos, but hopefully this visual helps you at least understand the different influences, and it can help you also understand the different approaches to reversing those and improving your overall hair health. I hope this is helpful.